and then we'll come back and have some of the officials talk about steps going forward to tighten our coordination and collaboration even more than we have done already. So with that, Mayor Walsh.
Thank you, Governor, and thank you very much for coming today. Really, the reason for today is to let the general public know about Ebola and the effects of Ebola and how you get Ebola. And I'm going to leave that to the experts, but just this collaboration the Governor spoke about has been going on for several months now between the Boston Public Health Commission and the Department of Public Health at the state level, talking about to be prepared in the case of an Ebola case here in Massachusetts and in Boston. And certainly we are well prepared in this city. We have world-class hospitals and facilities. We have well-trained personnel, both police, fire, EMS, in the city of Boston and also on the state level. And also it's about education and getting information out to the public. I know this weekend was very fearful for a lot of people, and my phone certainly was off the hook. But in the case of an Ebola case, we were prepared for it. And I think that really today is I would ask you to pay close attention to the experts, to the doctors who are going to be up here talking a little bit about Ebola, so we have an understanding of what the symptoms are and what the cases are. So with that, I'll answer some questions later, but I'd like to turn it over to the lawyers.
Commissioner, why don't you be able to come up and talk a little bit about that recognized?
Hi. So I know that there's a lot of public concern about Ebola virus disease, and we at the State Health Department are working closely with our colleagues at the Boston Public Health Commission and with the Centers for Disease Control to monitor the situation, to make people aware of what to look for, so that hospitals and first responders and others are aware early on when there's a suspected case of Ebola virus disease, and we're available 24/7 for consultation, as are our colleagues in Boston, to work with healthcare facilities, with providers around issues of suspected Ebola virus disease. I want to say that Ebola virus disease is difficult to contract, that it requires direct contact with the blood or body fluids of someone who has the disease. And it's not a subtle disease, it's not transmissible, and I think this is a really important point to make, by people who are not sick with the disease. So early in the course of the illness, even if people are incubating the disease, even before they become symptomatic, it is very difficult for them to spread the disease. It really requires, again, direct contact with the blood or body fluids of someone who is sick with Ebola virus disease. Dr. Wynn.
Thank you. We also want to take the opportunity to remind residents and all in our community that even though folks in the community, through the media and even in their own experience, may see first responders using precautionary measures to protect themselves and others from Ebola virus, the Ebola virus transmission, how people get Ebola, has not changed. You cannot get Ebola through the air or through the water. What that means is, if you have not touched the body fluids of a patient, of an individual who has Ebola, if you have not touched the vomit, the feces, the blood, the semen, the sweat of an individual with Ebola, sick with Ebola, you are not at risk for contracting or getting Ebola virus disease. That includes if you are in an airport, if you are in a room beyond 3 feet, beyond the social space of an individual who is sick, you are not at risk for contracting or getting the Ebola virus disease. We want to make that very clear. And also I want to repeat to all the residents what Governor Patrick has said. We do not have any confirmed cases of Ebola in Boston or in Massachusetts. Thank you.
All right, well, you are listening in on a news conference that's taking place right now at Logan Airport, started by Governor Deval Patrick. We also heard from Mayor Marty Walsh talking about the Ebola situation and just wanting to alleviate fears. But the biggest thing we learned out of this is that no one has been diagnosed with Ebola in the state of Massachusetts, and these are just merely precautions. They're trying to educate the public on what to look out for, how you would contract Ebola, also how you would avoid it. So, again, this is just state officials coming together to educate the public. We're going to have a lot more for you on this subject today during our new newscast. You're watching WBZ. I'm Catherine Hauser. We're going to head back to the programming already in progress.
That's it.
viruses